Look, for me, I guess I'm really very new to this area. I bring a few different hats. One is my interest in biomedical research, and that research is actually a very basic level. I'm interested in genes and in DNA and how the genome works. The other hat that I bring is as a paediatrician, and in particular with an interest in mental health. So I'm not a sociologist. I'm not an epidemiologist. The social determinants of health was a new phrase for me, and is something that I probably first heard of when I saw the advertising for this. So for me, it's been very much an eye-opening experience into the world of epidemiology and sociology and the social determinants of health. So it's been an amazing learning experience. Even within larger institutions, there's things that we need to be very mindful of in terms of trying to improve those social determinants of health. The example I'm thinking of is, for instance, what was described as systemic racism. So, it's not the racism between, two people and, saying something overtly racist, but it's those structures that are in place in institutions such as universities that are, I guess, naturally lead to inequality and to health inequality. Hospitals, there's sort of inherent racism that applies there, and when there's been a number of very nice studies now looking at racism that affects the quality of medical care that people get. And for me, that's a really interesting phenomenon. In a few hospitals I've been at, there's Aboriginal liaison officers, for instance, and when I first encountered them in a hospital, I thought, look, that's a really good idea. But as someone pointed out yesterday, in some ways it's good, but in some ways it's also tokenistic and doesn't address some of those other things that, the setup of the hospital wards and, other things that really need to be looked at. Certainly you want to be very wary of, biological determinism, the idea that, because someone's of a particular race, then this is going to happen. And I think, certainly in the past, there have been movements along those lines, and I think quite rightly people are very wary of that. And I think something that's important, in some of my work that, or some of my interests, is the interplay between genes and environment. The two are often seen as quite separate, but now there's this emerging field of what's called epigenetics, and it's looking at that interplay between genes and the environment. And it tells us the environment's very important in terms of turning on genes and turning off genes. And a thing that I find really fascinating is that sometimes that process of turning on and turning off happens early in life, and there's a critical window period. And if I can tell a little bit of a story, if that's all right, there's a guy in Toronto called Michael Meany who's done some really interesting work looking at behaviour in mammals, maternal sort of caregiving behaviour. So he, as researchers often do, uses an animal model. So he looks at rats, and it's been known for years and years that mother rats can be divided into two sort of broad groups in terms of their caregiving. Some give really good care to their pups, and some don't give very good care to their pups. And I was always thought it was genetic, because if you had a mum who was a high caring mum, then you also tended to show similar maternal behaviours. But then what Michael Meany did was he crossed the pups. After they were born, he put the pups from one group of mothers with the other mothers, and what they found was it was entirely environmental. It wasn't genetic at all. And what he also found was that there was a critical window. It had to be done, I think it was in the first week. Otherwise, it didn't happen. And so it was a really interesting way of how the environment can affect behaviour. But what he went on to show was that environment you got exposed to, so the maternal caregiving you were exposed to, turned the particular genes on, for the rest of those rats' lives. And what's a really important thing, I think, also to say is that they're starting to look at whether or not that's, how reversible that is, because you don't want to say that, there's no hope.